First, turn the illumination on its maximum. Instruct the patient to look straight and to open the eyes widely. Place your little finger on the patient's forehead and position the adapter in front of the patient's eye with your stretched hand. Now, slowly move towards the patient eye and make sure to keep the red reflex roughly in the center of the field of view. Continue this slow motion until you see the retina with the disc and the macula. You will notice that everything is inverse on the screen. That is always the case in indirect ophthalmoscopy and might make it a little bit difficult for you in the beginning. But soon you will know how to handle it. While it is relatively easy to image the macula and the disc, the periphery can be a little bit challenging. There are two options for imaging the periphery. The first option is to instruct the patient to look in different directions so that the area that you want to image gets into your field of view. The second option is to change the angle of the adapter and thereby your field of view. The second option is faster, but requires a little bit more experience. Before you capture an image, you can adjust two parameters with two different controllers. The first one is a controller to adjust the focus, and the second is a controller to adjust the light exposure of the sensor for more or less brightness. There is no autofocus in the camera software of the app. For focusing, hold your finger on the object that you want to focus on or adjust with the controller. There are different options for acquiring images. You can use the single image acquisition, burst mode, or video mode. For the beginning, the video mode is the easiest option. However, single images are much more convenient in a telemedical setting. Therefore, burst mode is the preferred acquisition mode. After each burst series of images, you will have to select the images that you want to upload. After you captured an image, you can also discard it if the quality is insufficient or if there is any other problem. Once you decide to save an image, you will have to define from which part of the fundus you captured it from. Next, you need to select the image.